Here's the agenda for the session. We'll be demonstrating some of the products from the last 2 years, as well as showing you the website, so you can see where you can find all of the guidance and these workshop materials, etc. I've sent you a handout this morning with all the links so you can find the resources after the session. The speakers here are all key members of the PPI workgroup, and I'd like to thank them in advance for their participation in this webinar, which is a culmination of the 2 years of work. I'll now hand over to Louise Goswami.
Morning, sorry, satellite delay there. I'm Louise Goswami, and I'd like to thank you for joining us on the webinar this morning and for agreeing to act as cascaders for the training materials. I'm hoping that doesn't come as a surprise to you. I also want to add my thanks to those that have actually done a huge amount of work developing the materials associated with the public and patient information workstream, and I'm sure by the time we get to the end of the webinar this morning, you will notice how much work's gone into this actual programme of work over the last 2 years. In terms of the work that we would like you to cascade to your networks, the aims of that are to have a better understanding of how Library Knowledge Services staff can support the provision of patients and public with information, and why we're the right group to take this forward. Actually increase your own confidence in your role in provision of public and patient information, and have increased capabilities to deal with inquiries. There's a number of quick wins that you'll see as we go through the session this morning, with some straightforward actions and some really easy ideas for you to make a significant impact in terms of service delivery and provision of services to patients and the public. In terms of cascading the training, what we want you to do is run workshops on public and patient information across your network to cascade the training. We want to encourage healthcare librarians and knowledge specialists to use the tools and techniques and build their skills, and actually be able to better manage provision of public and patient information as a routine element of their everyday work. We want to collaborate on PPI solutions across services and engage colleagues in other networks, whether they be librarians, knowledge specialists, other healthcare professionals, in taking this work forward. In terms of how to cascade the tools and learning from today, think about when and where you might want to cascade the training, and also have conversations with the CPD leads in your network so that it can be scheduled as part of any wider programme of training. Make sure that you're familiar with the content of the programme and tools, and try some of the techniques for yourself. And make sure that you're shouting loud and proud about the innovation and good practice, not just locally, but regionally and nationally, because what you think is just standard practice, other people might think are fantastic ideas. So do please share what you're doing. Draw in local expertise to help you deliver it. Involve others in planning, so don't do it on your own. Work together to deliver it. Make sure you brief your facilitators and bring in any natural champions that you have that will shout loud about the ability that you as library service professionals have in delivering patient and public information. What you'll see as we go through the session today is there are standard materials for you to use. There's a standard agenda, programme, resources and evaluation, and we'll give you more information about those as we go through the session today. In terms of today, as Sarah said, this is our second outing of webinar technology, and you're in listen-only mode, which is slightly bizarre, but if you do want to ask questions, please use the chat box and we will respond to your questions, and we will stay online at the end of the session if there are questions that you don't have time to ask as you go through today. Please complete the polls when they appear on your screen, and don't forget to complete the evaluation following the session. I hope you enjoy the webinar. There is now going to be another short poll.
Okay, this question is, do you have any local events planned already where you can cascade this training? just give you a chance to answer. That's great. We've got 78% of you have nothing planned as yet, but 22% we're firming up plans for an event already, so that's great. Thank you very much.
Hi everyone, I'm Holly Case. Hopefully you can see my screen. I've been chairing Task and Finish Group number 3, and we have been creating a suite of resources to help you in various ways to provide patient and public information, including the workshop materials that I'm about to talk you through now. We have created these workshop materials for anyone to use in any situation where they want to talk to Library and Knowledge Service staff about patient and public information. The use of the whole of the materials will create a full or half-day workshop, but they can be split up and used for smaller situations such as staff meetings or regional meetings. The workshop materials have been created to save you time and to ensure that you have the right and relevant information about patient and public information. The materials have already been piloted during a workshop in Taunton, which was very well received by those in attendance. They have been tweaked several times based on the feedback from that session and from the feedback provided by members of the PPI group. You will find all of the materials on the Patient and Public Resources page of the Knowledge for Healthcare website. There are further resources available here as well, which Carol-Anne and Natasha will take you through later on. So here's the Patient and Public Information web page, and they're in the resources page here. Here they are. So let me take you through what we've got available for you. So first of all, we have a Word document, which is a supporting document for running a workshop. It will explain each section and what additional documents you might need. You'll also see that we recommend inviting a guest. Carol-Anne will talk about this in her section a little bit later. So onto the slide packs. Our first slide pack is the scene. This pack will set the scene for patient and public information in Library and Knowledge Services. It includes an introduction to Health Education England and Knowledge for Healthcare, information about our partners, more information about the PPI working group, our objectives and the work we've already carried out. Each pack contains a contents page. Here's the contents page for pack 1. You can now go here and select which sections you want to use. On to workshop pack number 2. This is getting started. This pack will give you more information on areas to get involved with and to support the PPI agenda. This section includes information on health literacy, the Library Quality Assurance Framework, Health Information Week, which Sarah will be detailing further later on in today's session, local collaborations, the Information Standard, which Dan will be talking about, sustainability and transformation plans. You will find on most of the slides sections which might need further information or background, notes to accompany them. So here is the slide on LQOF, and you can see down here there's some further notes about what you might need to talk about. Pack 3 is our priorities exercise. This is an interactive exercise which is a great way to get participants talking and thinking and filled with ideas and quick wins for them to take away with them from the session. And Sarah is going to be going through how to set this up and go through it later on as well. Other supporting documents we have are a draft agenda. So this was taken from our workshop in Taunton, but how long the session you do is up to you. But we wanted to give you an idea of how we structured that pilot session, and it did work very well. As I mentioned before, you'll see that we included guest presenters, and Carol-Anne will discuss that further later. And you'll also see that in the last slot we have invited people to present local ideas from that region, which actually takes us on to the next document that's available to you, which is regional ideas. So to support those local presentations, this document has taken some selected ideas from our ideas bank and sorted them regionally just to bolster that section of the agenda if necessary. For more ideas in your local area, you could revisit the Ideas Bank, which again is on the resources page of the PPI section on the Knowledge for Healthcare website. And finally, we have an evaluation form. This is for you to use after each session that you do, and this will provide you feedback on the areas that your participants may need further information on. We would love, the PPI group would love to see your collated feedback to see how this work is being received nationally. If you have any questions about the handout, the workshop materials, then please do pop them into the questions section on the right-hand side of your screen. But other than that, I will now hand you over to Carol Ann.
Good morning, I'm Carol Ann Regan and I have been co-chairing the National Steering Group with Louise Goswami as well as Task and Finish Group 4 with Natasha Howard. We have included this section to give you some key background information on why PPI is important and an information on what the Task and Finish groups have developed to help you. This particular session has formed a key part of any face-to-face training we've delivered. We are using slides from the packs that Holly introduced you to. In any training you deliver, it is important to emphasise how services develop their work in this area will be influenced by their local circumstances, and such work will not necessarily mean hordes of patients flocking into our libraries. We can support this agenda both directly and indirectly. It is good to use this slide to remind colleagues of the vision of Knowledge for Healthcare and how information for patients and the public is a key part. Using the next two slides, you can outline why patients need health information and how NHS library staff can contribute to this. This slide gives the case from the patient side. We know that the drive for patient self-management and their role as partners in their healthcare has increased the need for patients and the public to have access to quality, reliable health information. So what about the role of NHS libraries? Using this slide will help emphasise some key points, particularly that we are already partners in patient care with the work we do with healthcare colleagues. We can support these colleagues as they support patients. Also, we have key skills we can adapt. We have skills in finding the evidence, appraising it, and making it readily available in formats applicable not only to healthcare colleagues but also patients and the public. So as patients need access to a range of resources tailored to their information need and literacy levels, we in NHS libraries can act as signposts to the resources these groups need to empower them to be active participants in their health and well-being. This slide gives a useful visual on the need for health information, both from a demographic and financial standpoint. So these slides have given the background. However, within any training session, you will need to outline the work of the Task and Finish groups and the resources they have produced to support services. We suggest that you split this into what was achieved in Year 1 and then Year 2. This slide covers the main concepts for Year 1, partnerships, the guidance, and the Ideas Bank. Let's look at these in more detail. The key message here is the variety of organisations that we have made contact with and we now partner, and we have certainly raised the profile of NHS libraries and their staff and what we can offer. The two main resources from Year 1 were the Guidance and the Ideas Bank. Natasha will discuss these further in her section. But the key message here for services is that getting involved in PPI, as we've said, does not mean hordes of patients making their way to libraries. And it helps to use the next slide to explain the guidance further. Key here is the section on types of service. There are 6 outlined in the guidance, and they cover both direct contact with patients and supporting this agenda via our work with healthcare colleagues. Again, Natasha will demonstrate this further. The Ideas Bank was created from examples from ELQOF, HLG presentations, and the Sally Hernando innovations. It is useful to have printed copies at training events. Do encourage people at training events to send new ideas going forward so we can share best practice. Again, Natasha will look at this further in her section. So that was year 1. So in year 2, we had 3 working task and finish groups and an overarching steering group. This section will briefly outline their work and resources as a guide to what you need to deliver in any training session. Using the next 2 slides, you can outline the work of Task and Finish Group 2. Dan will talk more about it in his section, but their remit was to communicate the standards required by NH organisations and produce accompanying driver diagrams. This slide for Task and Finish Group 2 has the links to key documents. Again, we have 2 useful slides for outlining the work of Task and Finish Group 3. They have developed the training materials, and you heard about the slide packs from Holly. They have also produced guidance on partnership working and on using NHS choices. Natasha will demonstrate all of these in her session, but of course in any training session you facilitate, you may choose to demonstrate these as you go along. And now 2 slides for Task and Finish Group 4. Key to point out here is that the Guidance and Ideas Bank have both been updated. Also as a group, we have recently published guidance for library assistants to use alongside the main guidance. This is in a useful question and answer format, dealing with some very practical concerns your library assistants may have. For example, what to do if a patient gets upset. Again, it's useful to have printed copies at any training event. This just outlines the progress to date for Task and Finish Group 4. When you are facilitating this session on the Task and Finish groups and resources, do keep emphasising the importance of using the website to see current output. And lastly, in this first session, it's useful to look at ELQOF. We have 2 useful slides on this. This is a textual one, but my favourite is this pictorial one. It's particularly useful as it gives helpful examples of what makes a difference between being partially compliant and fully compliant. So you've now heard an outline of why Library and Knowledge Services staff should support PPI and what the Task and Finish groups have produced to aid you in this agenda. Before we hand over to our next presentator, Natasha, who will guide you through the key parts of the website and demonstrate the resources, you will now have a question appear on your screens. Please answer it, and then we will move on to Natasha.
So the question is, one of the things that Natasha is going to show you in the next session is the Ideas Bank. We would like to know if you've seen the Ideas Bank before, or if you've used it. Okay, you've all voted. That's great. We've got 44% have not seen it before, 33% yes, just a quick look, and 22% yes, we've used it already. Thank you very much. So I'm just making Natasha presenter.
Hi everyone, I'm Natasha Howard and I've been co-chairing Task and Finish Group 4 with Carol Ann. I'm going to demonstrate some of the PPI content on the Knowledge for Healthcare website, which hopefully you can see up on my screen now. The address for the website is Knowledge for Healthcare at is kfh.libraryservices.nhs.uk. On the front page of the website are the most recent blogs. Currently, or coincidentally, the most recent one up is about the guidance for library assistants that we've just produced. I'll show you that shortly. I've also been asked to point out that if you scroll down the front page, you can link to all the blog posts organised by Knowledge for Healthcare working groups and Task and Finish groups. And if you have a look there, you can see that we have done the most posts out of all the groups. Okay, so if I scroll up to, we've got the menu at the top and patient and public information. If I mouse over there, we've got a menu that appears and we've got all the different sections listed there. About the PPI workstream, making the case, types of service, ideas bank, resources, useful links. If I click on the link at the top, patient and public information, we are straight into our comprehensive guidance. Now, you can download the guidance as a PDF. I'll show you that link in a second. Or you can look at the different sections online, and that's what I'm going to do with you now. Okay, so this is our introduction page. At the top, or near the top, we have this statement here explaining what the guidance is about and who it's aimed at. This is for any patients who might find themselves on this page. Next, we repeat the Knowledge for Healthcare vision statement, reminding us why this is relevant. Further down, we have a section on support, outlining what we have produced to support library staff. This is where you will find the link to download the guidance as a PDF. We've then got a bit about LQOF and the revised criteria that Carol Ann talked about a moment ago. Okay, so if I scroll back to the top and move on to the next link, making the case, I'm not actually going to click on this one today. This is where we have some information about why NHS libraries play a key role in patient and public information. This is where you'll find a link to the driver's document that Dan is going to talk about later on. The next link, types of service, I just didn't double click there. The next link, types of service, lists the 6 types of service that an NHS library might offer to the public. And if I scroll down, you can see them all there. The first one, helping healthcare staff to provide high quality patient information. This is actually about contributing to a trust achieving the information standard, and Dan's going to talk to you about the information standard later on. The next example, walk-in use of print resources for reference. Then we've got inquiry service for patients and the public, collaboration with your local public library service, facilitating patient or public health literacy, and then the last one, opening the library to the public. Please note, this is at the bottom of the list because there are lots of things that you can do before you get to that. Now, if I scroll back up to the top, Before we move on, I want to focus a bit on these links to dealing with inquiries there and our detailed guidance for library assistants. Although we want to be clear that opening the library to patients is only one option, we have produced some detailed guidance on dealing with inquiries and a special document for library assistants. If I click on this guidance for library assistants, here it is. Now, the idea of this guidance is to help increase confidence. It explains the library assistant's role, the need to be clear about boundaries, and goes on to answer a number of frequently asked questions on things like what to do if a patient becomes upset in the library, copyright, open ASINs, and if we scroll down near the bottom, there is a suggested disclaimer there that you can add to any information that you provide to patients. We don't intend for this guidance for library assistants to stand alone. We hope that library managers will see it as a tool and use it with their staff to help develop their confidence. Okay, so if I go back and move on to the next link, the Ideas Bank. The Ideas Bank is where we have collated examples of best practice from around the region of how libraries are currently engaging with the public and patients for their health information needs. The guidance was originally produced in 2016 and then we updated it in January of this year. You can download the updated PDF here. And I'm going to click on the link now. This is the Ideas Bank. It is one of my favorite things that we have done. It is only 5 pages long and the ideas are all categorized. We have internal staff partnerships, patient and carer support, information literacy, health information promotion, engagement with public libraries, and voluntary organisations. As you might have seen as I was scrolling along, all of the new and updated content has been highlighted in pink. Some of the new ideas that were added in January included loaning old staff PCs to patients, organising lectures, and lots of ideas for Health Information Week, which Sarah is going to talk about later on. As you can see, where available, there are links to further information, to innovation submissions, to conference presentations. So that's the Ideas Bank. We really hope that if you haven't seen it before, that you will come back and have a look and really spend some time checking out all of these great ideas that are already in practice. Okay, so we're nearly there now. I'm just going to whip through another couple of links. The link here to resources. If I click on that, you've already seen this briefly, Holly showed it to you. This page lists all of the resources that you can use. At the top, we have resources for partnerships and networking. If you're thinking about developing a local network, there's draft MOU, agenda, etc. We also mentioned the PPI contacts database. We have a database of people, of staff who are interested in this agenda from different sectors, different organisations. You can ask to be added or to consult the database. Next, we have the workshop materials that Holly has already shown you. And then further down, we have training resources. So these are courses, leaflets, and websites that you might want to use with different audiences, library staff, healthcare staff, public library staff, or the public. Many of them are available for you to adapt and where that's okay, we have highlighted that. I just want to have a look, or show you even, the one at the bottom here, the Guide to NHS Choices. So this is aimed at informing librarians from all sectors who may wish to share it with members of the public. If I click on the link to download the PDF, that should come up there, and there you have it. It is our practical guide to searching NHS choices. It is only 4 pages long. It is very clear and very practical. And again, some frequently asked questions at the end. Okay, so if I click back, and I'm going on to my last link, useful links. We have a substantial list of useful links on various topics. If I click on this one, quality health information resources from the public, your trust may have a list of patient information leaflets which should be used first, but here we put a list of recommended websites for signposting members of the public too. Okay, so that was about everything that I planned to show you. You're now going to have another question appear on your screen. Please answer it, and then we will move on.
Hello, we're going to have 2 questions now. The first one is asking if the NHS Choices Guide looks useful to promote. Thank you. You've all voted. So we've got 89% said yes, good for staff and public, and 11% yes, probably just to staff. Thank you very much. And we've just got the next question is asking if you can see yourself using the networking resources. Those networking resources can be used just for initial conversations with your public libraries or something like that. It's not that you've all got to set off with a whole great big partnership, with a whole great big network. It can just be for individual partnerships. Okay, everyone's voted. We've got 67% said I'll need to look at them in more detail, and 33% said yes straight away. That's great. Thank you very much. And we're going on to Dan.
Okay, hello everyone. Hopefully you can see my screen now. My name's Dan Livesey, and I've been chairing Task and Finish Group 2. We've been focusing on the standards when producing or commissioning health information. And we've also been looking at advocating involvement.
Hi Dan,
in PPM.
sorry to interrupt. I don't think we can see your screen.
Oh, sorry.
Sorry.
Did you get the pop-up box, Dan, that you have to click on OK?
No, but I am able to share it. So. Can I share it back to you, and then you can share it with me?
Yeah. Sorry, everyone. Technical hitch. That's better.
That's better. Can everyone see it? Yeah.
Yes, that's great.
Cool. So yeah, so I've been chairing Task and Finish Group 2, and we've been looking at the standards when producing or commissioning health information, and also advocating involvement. So we've essentially produced two products. One is our driver's diagram, and the other is a guide to the information standard. The first product that I'm going to show you is our driver's diagram. And maybe first it's important to define what a driver diagram is, or a driver is. A driver is a factor that shapes the direction of your organization. This could be a strategic document, a business plan, a regulatory requirement that impacts upon your service, organization, or the NHS as a whole. So what have we actually done? Well, our Task and Finish group has put together a list of relevant drivers and summarised each one. There are currently 13 summaries available, but as new drivers emerge, further examples will hopefully be added. All of our drivers have been designed using the templates provided by the Making Alignment a Priority, or MAP toolkit, which is available via the MAP Toolkit WordPress site. And further tools are also available via the MAP Toolkit, and these will help you consider your aim, tell your story, and demonstrate your impact. So how will you use these drivers? Well, familiarising yourself with the drivers will give you a broader understanding of the priorities for your organisation around patient information. They will be particularly useful if you're embarking upon a new patient information project. There is a particular patient-focused element of your service that you need to justify. If you need to justify the impact of your service to members of the public, or if you want to propose a service development or new patient information initiative. So in order to access our drive diagrams, and Tasha touched on it a little bit earlier, you can go to the patient information section here on the Knowledge for Healthcare website. Scrolling down to Making the Case. And here you'll see a paragraph with new drivers. And clicking on this link here will take you to our drivers section. And you'll find some of the information that I've been sharing with you now about what a driver is and how you will hopefully use the drivers. Clicking on the link here will take you directly to our driver document. Each of these has been summarised, and clicking on the link in the contents page will take you directly to that particular driver. Each summary is only a page long. It also provides a link to the original document. And also provides some examples of how library and knowledge services are already contributing in this area. So why would you use the drivers? Well, driver summaries can help you to develop your patient information offer at your library and knowledge service. They can involve service planning or strategy design. They can improve a business case or proposal for funding, and they can also help you demonstrate the impact of a project or a service. So now I'm going to talk a little bit about our other product, and that's a guide to standards. I think it's important to define what the Information Standard, or TIS, actually is. The Information Standard Scheme shows NHS England's commitment to improving the quality of health and care information that is available to patients, public, and health and care professionals. Certification of TIS is recognition that an organisation has a robust process to inform the production and the commissioning of health and social care information for patients and the public. The Information Standard assures that certified members have a clearly defined and written process for production. It ensures that this process is followed, there is evidence it is followed, and the process is independently verified. So what have we actually done? The Knowledge for Healthcare Patient and Public Task and Finish Group 2 has developed a guide for the Library and Knowledge Service staff to the Information Standard, and I'll show you this now. if you go to types of service, and then helping healthcare staff to provide high quality patient information. Again, there's a section marked new, and this is where you can download the guide to the information standard. And so this is our guide. The guide presents the 6 principles of the information standard. So those being information production, evidence sources, user understanding and involvement, the end product, feedback, and review. It gives examples of each of the requirements and gives examples of how library and knowledge services are already supporting processes of commissioning or quality assuring resources in their organisations. The examples included are from a variety of services across England. Some are members of the information standard and some are not. So how will you use the guide? Well, the guide presents each principle and provides an example and identifies potential next steps for the library and knowledge services. The guide is not designed to help you and your organisation apply for the information standard. It is a guide which shows how library and knowledge services are already using their skills to support the production or commissioning of patient or public information. It's really a good practice guide. I think it's also interesting, we've managed to include 2 case studies. So the 2 case studies, the first is from Blackpool Teaching Hospitals and their work around the information standard and helping their organisation to achieve the information standard. And then there's also an example from Shrewsbury and Telford Hospitals. There are also some additional resources available via the information standard website. So now I'm going to hand over back to Sarah.
Hello. Before we go on to the next bit, I just wanted to remind you all that you can send in questions if you would like for any of the panelists or anything that you've heard already. That would be great. Just use the question mark on your screens. So I'm going to talk about the activities that we've got. There's a series of activities that we've written up as Word documents on the website with all of the instructions required to run them yourselves. The Icebreakers document has a few different icebreaker exercises and some other ideas to get a bit more interaction into your sessions. For example, there are ways to mix up groups so that people from the same organisation are not sitting in clusters. The exercise that we've done at several workshops already and has been very successful is the prioritisation matrix exercise, which I will run through for you now in more detail. This prioritisation exercise is made up of several tasks that could be done across one workshop, but could also be split between a series of meetings. The aim is to get participants to work out which of the PPI ideas and tasks are their highest priority, and this will differ depending on local factors. These next 4 slides are in the slide pack for you to use, and I've inserted examples of the flip charts from workshops earlier this year. Each table needs a piece of flip chart paper, pen and a sheet of labels, which I'll show you here. So these are ready set up to print on labels paper, or you can print them on ordinary paper to use with Blu-Tack so that they're movable, which is sometimes more useful, and I'll show you in a bit more detail now. So each group is asked to write this chart on their this grid on their flip chart. And then you ask each group to place each sticker one by one where they feel they should go on the grid, depending on how easy they think it would be to implement and how useful they would be to patients and public in their organisation. It's a good idea to nominate one person from each group to take notes on the discussions that occur noting any good ideas or barriers that people come up with. You can ask participants to add 2 or 3 more ideas of their own to the grid on post-it notes, or use ideas that they brought with them. So this is an example of one of the finished flip chart papers from one of the tables. So you can see by this method, the top right-hand corner are going to be your top priority ones, because they are the easiest to implement and the most useful to patients and the public. So they're the easy wins that have the greatest impact. In the next part of the workshop, while another presentation is happening, the presenter, or someone else, now needs to write up on a new flip chart sheet the top 10 ideas from the group work, and then over lunch ask the participants to add their trust initials to those ideas that they already do, and also to those that they would like to do in future. And here's an example from the Southwest. It's not very easy to read, but you can get the general gist of it. What I did was print off an extra sheet of the labels so that we could immediately just put them onto the new flip chart sheet, and then got people to sign up which ones they already do and which ones they would like to do. In this way, you can get groups together to work on individual ideas, sharing good practice from those that have already done it. This is an optional slide that you can adapt to suit your needs. You may have a follow-up PPI session in mind to take the top few ideas further, or to set up small action groups based on who has signed up to specific ideas. It's also useful to encourage participants to take away with them 2 to 3 actions that they feel are easily achievable in their organisation, and this may differ depending on the organisation. You can also use the ideas bank and case studies from the guidance for even more ideas to use. Another exercise you can do is to look at the actions in the lower right-hand quadrant, i.e. those that are useful to the public but hard to implement, and discuss what actions might be taken to move these upwards to make them easier to implement. Oops. If you can emphasize a couple of ideas that participants have found easy and would be easy to achieve, and mention these where possible in the afternoon talks. For example, if you have a talk about Health Information Week, which leads me neatly onto the next few slides, which covers Health Information Week. These next slides are all in the slide pack available on the website for you to adapt to suit your needs. The slides outline the background, this one, why you should get involved in Health Information Week, examples from previous years, and these have been done in health libraries and public libraries and other organisations as well, and a mixture and partnerships between them. This is some examples of some of the displays. And we've got more specific examples from health libraries in particular. You can, of course, use the ideas bank again and to look at ideas that were in the top right quadrant of the prioritisation activity done earlier. These should be easy wins which they could plan to do in Health Information Week. For example, promote the NHS Choices Guide, which Natasha showed you earlier. And this link at the bottom here, which you've also got in your handouts, is where to find all the Health Information Week information. It's recently been moved here to have it all in one place on the Knowledge for Healthcare website. Please encourage participants to get planning or start conversations with public libraries in particular. Public libraries are also being encouraged to do events for Health Information Week. We've now got 2 poll questions for you, and then I will hand over to Carol Ann, who will tell you a bit more about running the workshop. The first question is asking if you've had any contact with your local public library. Okay, most of you have voted. We've got 38% have said no, 25% no, but I plan to very soon. 25% say a little, we know key people, and 13% say yes, we've already got an established partnership. That's great. And the other poll question is asking you if you have any plans for Health Information Week at the moment. Okay, thank you. Everyone's voted. We've got 11% say no, 44% say not yet, but I hope to, 33% say yes, we will hold a local event, and 11% say yes in partnership with other organisations. That's great. Thank you very much. So Carol Ann will be the next speaker. Carol Ann, have you got the pop-up?
No, I haven't got the pop-up, no, and I've just moved my screen to make sure it's not hiding anywhere.
Can you put it back to me and I will put it back to you again?
Just bear with me. Right, I've put it back to you. Got it. Thank you. Hi. So having heard all about the resources we've developed, what about some of the practicalities of actually running a workshop? In this section, I'd like to look at what worked really well at the workshop we ran in the Southwest. I'd like to make some suggestions for speakers and also what handouts to have samples of. So at Taunton, 3 sessions got excellent feedback on being the most helpful. Sarah facilitated the prioritisation exercise, and I'll mention more in a moment. We had a session on the background to PPI and what resources had been developed. This was a session similar to the one that I delivered earlier in the webinar. And we also had 4 5-minute slots from colleagues in the region on what they were doing. This was really encouraging as we used examples showing both direct and indirect support. So we had an example of somebody who works directly with patients from a mental health trust, and we had other colleagues looking at what they were doing to support perhaps the evidence basing of guidelines. Sarah has already outlined how this works, and this is an example from the Taunton priority list. It's really worthwhile doing this exercise as it reinforces that many services are already involved in PPI, and it also helps to identify really quick wins. So as you can see from the Taunton workshop, we had a top one as a quick win, familiarise library staff with NHS choices. A second quick win was to actually include NHS choices in any staff inductions that we do. So as I say, a variety of quick wins. This is some feedback from the workshop, and apart from demonstrating how useful people find the workshop, this feedback shows the importance of emphasising how services support PPI will be very much influenced by local circumstances and doesn't necessarily mean working with patients directly. As you can see here, that emphasising that made people feel much more comfortable about the whole PPI agenda. This feedback shows that, again, sharing examples of good practice was very helpful. So who to have as speakers? You can use the contacts list on the Knowledge for Healthcare website for help. You can also look for local speakers. At Taunton, we engaged a speaker from the local public library service, and this gave a lot of local context, and we found out quite a lot about what was going on in our local public libraries. It also helped generate some partnership working opportunities at the meeting. Most regions will also have access to perhaps colleagues from the third sector, for example Macmillan, and they will help you on any session that you feel you want to put in on communication with patients. And lastly, it was very helpful to have printed examples of some of the key resources available, and I can assure you none were left by the end of the day. Do continue to emphasise, though, that the up-to-date resources can be found on the website. So as you can see, running a workshop not only builds confidence and gives services resources that they can use, either directly or indirectly, but it also helps reinforce the message that how we support PPI will be very much dictated by our local circumstances. I'd now like to hand back to Holly.
Thank you, Carol Ann. So, finally, just to reiterate, the workshop materials and all the other resources we've discussed today are available on the resources page of the PPI section of the Knowledge for Healthcare webpage. Hopefully, you're taking away with you today the relevant background information and materials to enable you to cascade this work. Think about when and where you will be holding your session, who you will invite, and who can support you. You can decide what your session will look like based on the information we've given you and the materials provided, and we've shown you how to successfully run a patient and public workshop. We are available to support. If you need some further advice or you'd like us to look over your proposed agenda, we're very happy to help. So finally, we've got one more poll, I think, or maybe two. Thinking about the first question that you had at the beginning of the session, and now, how much do you now know about the PPI work?
We've got, okay, everyone's...
Oh, sorry. I can see nobody has said not very much at all. That would have been terrible. 89% of you have said quite a lot, and 11% of you have said I am very familiar with the PPI workstream, which is fantastic. So the recording of this session and the results of the polls we've taken today and an evaluation form will be sent round to you. So please fill in the evaluation form so we can see how this Train the Trainer session has been. I'd like to thank you for participating. I hope you're excited to be running your own PPI workshop. And I need to say a really big thank you to Sarah, Louise, Carol Ann, Natasha and Dan for the work that they've been doing on this as well. We're going to stop the recording, but we're going to hang around. So please use the question section and let us know if you've got anything you want us to answer. Okay, thank you very much.